So that's a great lead-in for our next speaker who was highlighted on that video, which is Dr. Keith Smith, who's a hard guy to get a hold of because he's running one of the best surgery centers in the country, and he's probably got to do a surgery right after this. So Dr. Smith, are you there? Thanks for joining us.
I am. Thank you, Daniel, for having me.
So yeah, why don't you share with us a little bit about what you started and why it's a good thing?
Okay, I started the Surgery Center of Oklahoma in 1997 with the idea that we would always tell patients what they were going to pay us, whether they had insurance or not. And we also decided we would deliver the highest quality of care that was possible. And also, at the same time, be patients' financial advocates as well as their medical advocates. So we started this organization in 1997. It's been a wild success. In 2012, I decided to post the prices for all of the procedures that we perform on a website. It seemed right for everyone to know, just as Cynthia has said, for people to know what they were going to pay before the service was rendered, if at all possible. The first patients that arrived after we made this, what now looking back was a radical move, were Canadians, people that after all have a safety net of coverage, but they do not have access to the care many of them require as the only tool available in a system like that to limit expenditures is rationing. We saw many Canadians, we saw many uninsured, and then we found the mother lode of sticker shocked buyers in the United States, and that was the self-funded industry. I was very lucky and fortunate to meet my friend Jay Kempton. Jay runs a third-party administrator where he purchases medical services on behalf of his clients who purchase those services out of operating revenue rather than through one of the carriers. Jay began buying the services that we provided at the posted prices online for the benefit of his clients, and saw as much as 80% savings over time. One of our early clients was Oklahoma County, all of the employees of Oklahoma County, the largest county in the state. And they have about 1,100 employees, and they saved a little over $3 million the first year on their self-funded plan. Many of these employees are not people that anyone on this webinar would consider highly compensated. And as they would come in December, one of my favorite times of the year, they will tell us that, you know, our child is having their tonsillectomy and we're going to have Christmas this year. You know, if it weren't for this setup where the patient's out of pocket is completely waived for making a smart choice. If it weren't for that setup, they would have to choose whether they were going to have Christmas or pay for the surgery. So we made this move. It's grown remarkably, just as Cynthia has said. Jay Kempton's vision to start the Free Market Medical Association, I think, was a very, very smart move, and so we've been joined by people in the industry on the self-funded side, stop-loss carriers, think tanks, surgery centers, imaging centers, hospitals, many physicians that want to promote these ideas. Occasionally, I'm asked, you know, why isn't this movement any bigger than it is? And my response is that if you consider the headwinds and you consider the power and the lobbying muscle that the members of what I call the medical cartel have, it's astonishing that this movement even continues to exist, much less grow, as Cynthia has said. There are many people involved in this effort. It's very much a team effort. Everyone roots for their competitors in this effort. It's not uncommon for me or any member of the Free Market Medical Association to receive a request for help. How do I develop what you've done? And we freely offer advice to our competitors because our our vision is not just one to increase our capital and revenue. Our vision is really to change the healthcare system. I think that I can make a compelling case that we have done that for many of the hospitals in my area. I think many of you might understand might not have been friends of mine up until recently. They realized that there were patients traveling to Oklahoma from all 50 states and even out of the country. Indeed, I began to receive requests for surgical procedures that could not be performed on an outpatient basis, and reached out to hospital CEOs, hospital CFOs, and asked them if they would be interested at all in offering a robotic prostatectomy to someone from Florida, for instance. And they were shocked that I reached out, but indeed they were interested. So we have people that are cloaked, people that are just putting their toe in the water, that are part of this free market movement that cannot be identified at all. Part of the reason they're afraid to be identified, excuse me, is they have these carrier contracts, the contents of which are secret by terms of the contract. That's one of the most exciting parts, I think, of the demand that hospitals and insurance companies reveal the terms of these contracts. That will free up hospitals to actually act in a more consumer-friendly way as patients' financial and medical advocate, just as we have. I have no constraints because we have no carrier contracts, and we have no desire to deal with any of the carriers. They certainly have no desire to deal with me because their claims repricing opportunity and the revenue that they skim from that activity is foregone when my prices are posted. So we are very excited to be part of this movement. I could make, I think, a good argument that the movement started in Oklahoma, even perhaps that it started at my surgery center. It's very gratifying to see this movement grow. I had I think a tinfoil hat placed on me when I put prices online 12 years ago. And the narrative has changed. The narrative really has changed. Those of us that post prices are no longer the strange outlier weirdos. Those who will not reveal a price are the ones who have some explaining to do. So I'm happy to be part of your webinar, and happy to answer any questions the audience might have.
Yeah, so I'll take any questions from the audience physically here or Q&A. I'll just add something interesting to your last point. There are rules in place now where providers actually are going to be forced to be price transparent next year, and they're kind of panicking. And I was working with one provider, and they were trying to figure out, how do we do this? How do we figure it out up front? So they don't even know how to do it. So they're working on that. But then this is my favorite comment. Somebody said, what if our prices are higher than the other people? Won't they want to go there instead? I thought, you just discovered capitalism. That's the way the market works. So Dr. Watchmaker has a question.
Dr. Smith, Greg Watchmaker, Milwaukee. I'm a hand surgeon. And both you and the speaker before you talked about having the patient be a consumer and looking at their care themselves. And if our senator is still on the line, there's one federal direction which is contrary to that and still has steam, which is in the form of accountable care organizations. When I was in medical school, I came to medicine right as there was the death of paternalism. It used to be that we felt the patient was not knowledgeable enough in our craft, and we needed to tell the patient what they needed, instead of educating the patient about their problem and allowing them to decide, or at least have what we refer to as shared decision-making. So the way I was taught to practice and how I practice now is very much patient education, and then a list of options and where you can go with your treatment. That type of decision-making by the patient is what truly empowers consumerism. But yet federally, we still are embracing what are called accountable care organizations, where a system of doctors and hospitals and administrative people account for the care of an individual. They, in the most paternalistic way, are held financially responsible for the health of a population. It actually sounds somewhat benevolent, but buried beneath that benevolence is the paternalism that increases the cost of care by taking decision-making away from the patient. I wonder if you could comment on accountable care organizations and where you think their role is or what we should do about them.
Yeah, I wrote a blog years ago called ACOs, HMOs by another name. The worst part of accountable care organizations, in my opinion, is that they become more profitable to the extent that care is denied to the patient. So the physicians involved are actually rent seekers and make more money to the extent that money is saved. And that is an obvious conflict of interest because money can be saved by denying care. So ACOs or HMOs by any definition, and that is the inherent conflict that I think must be acknowledged. There are some HMOs that I know have avoided this conflict by and large, but primarily they're very much revenue focused. I'd also add there are two economic models I believe in this country that pertain to this industry. One is how do I generate maximal revenue? I don't know how many emails I get every day from people that are revenue cycle managers, and they want to help me make sure I put all the codes down so that I maximize revenue. And unfortunately, that is the prevalent model in this country, and I blame the federal government primarily for this, because this is all a manifestation of the disaster of the resource-based relative value scale that was endorsed by all of the big medical organizations and also put out by Harvard. It's been a disaster. So anyhow, that is the prevalent model, and I believe that is who's at fault and where it came from. The model that's growing is how do I deliver maximal value rather than how do I render maximal revenue to myself. The reason I'm going through this is how do I render maximal value answers the question of the person who says, wow, when I post my prices online, they're higher than the provider, the physician, the surgery center across the street. Well, that's okay. Perhaps that ambulatory surgery center or hospital is better than the one across the street. And so the prices do not have to be the same. And consumers pay all different kinds of prices for different brands and different things because they see different values. So I think as we see more focus on value rather than on revenue, we'll see the price dance occur in this market. And then we'll see true pricing that emerges out of a competitive market rather than pricing that is imposed by these all-knowing bureaucrats who actually think they know what something should cost.
Yeah. And I think true pricing is something that should be bipartisan. That was Cynthia's point. Even if you, and I suspect you're not a person like this, Dr. Smith, that believes government should pay. They should pay real prices, and real prices are only determined by markets, which, by the way, I want to put in a plug. Later on, we have a true economist speaking later today that's going to back up a lot of what we're talking about with, which is really basic economic principles. So, which I think people think don't apply to healthcare, but that is a dangerously wrong assumption. Do we have other questions for Dr. Smith? We have a couple minutes. Wait, there might be something in the Q&A. Let me check here. We have a question. Yeah, come up to the microphone. And then we do have another question here.
Thank you, Dr. Smith. I first heard of your surgery center on the Econ Talk podcast with Russ Roberts. So thank you for getting the word out there. My main question is, if these are so successful, as you state, the numbers seem amazing, what are the barriers to entry, the main barriers to entry of other organizations like this getting started around the country? Are there top barriers to entry that you know of, or why aren't there more like you doing this exact same thing if they're both value-laden and profit-laden? Thank you.
Yeah, thank you. And again, I'm actually astonished that there are as many of us as there are, because the barriers are out there. One of the big barriers are certificate of need laws, something the federal government foisted on states, and then withdrew their demand of certificate of need and told the states, repeal it if you don't want it. Many states have repealed certificate of need laws, but certificate of need laws are basically a setup where a fledgling upstart that wants to start an MRI center, surgery center, or a hospital has to appear before a star chamber made up of his future competitors. And they, as you can imagine, are very conflicted, and they just deny requests for new facilities to enter the marketplace. Another barrier is the federal government itself, because of its price fixing in Medicare and Medicaid. That makes it very difficult to perform the economic calculation that an entrepreneur requires to know whether this makes sense at all. The other barrier is the buyer, and many of the buyers in the United States, including the self-funded industry, do not acknowledge the sticker shock that's appropriately applied to their self-funded health plan. Many times this is because they are blinded by the insurance carriers that serve as their third-party administrator, refusing to let them see their own purchasing data. The other problem is there are relationships between unscrupulous brokers who actually receive a percentage of claims and want no part of affordable care. There's a growing movement of fee-based brokers, insurance brokers in the United States, and consultants who are not paid some percentage of claims, or paid some commission, or paid by the carrier, paid directly by the carrier. So brokers are a big obstacle. Certificate of need is a big obstacle. The federal government is a huge obstacle. And physicians are fearful right now. Physicians have taken it on the chin. Sometimes organizations that have represented physicians have thrown the physicians completely under the bus and just let us get run over in return for receiving lucrative contracts from the federal government. Mm-hmm. And so there's a lot of headwinds that physicians face to do this. It's very courageous to go down this road, and that's one of the purposes the Free Market Medical Association performs, is to realize that you're not alone. There's networking that can be done, and this is kind of a brotherhood, and we support each other. And the awakening of the self-funded community is the key. When they decide as buyers that they do not want to waste money, then this movement will hit that tipping point and go completely viral.
Thanks, Dr. Smith. Wish we had more time on that. I think you answered the other question we had, which was why more employers and self-funded organizations don't take more advantage. You touched on that. So thanks very much, Dr. Smith. And